Tears are coming up.
Deborah Burchard moved her ailing father into a Northern California nursing home in September 2005. Within days, she says, he had completely changed.
Eyes glassed over with sweating, cracked mouth. Who is that person? I have no idea. How did that happen in 3 days?
Less than 4 weeks after entering the nursing home, William Killingsworth was dead. Burchard blames in part this antipsychotic drug the nursing home inappropriately gave her father, who suffered from dementia.
He was laying in his bed, unresponsive, and I just looked at him and thought, what's going on? I mean, you can look at this person and know that he needs some medical attention.
Antipsychotic drugs like these were never approved for elderly patients with dementia. In fact, in 2005, the FDA gave them its most severe warning, noting an increased risk of sudden death in patients with dementia. And now a new government study has found that 88% of the time Medicare paid for antipsychotic drugs in nursing homes, they went to patients with dementia. The report by the Health and Human Services Inspector General also found that antipsychotic drugs were given to nursing home residents unnecessarily over 300,000 times between January and June 2007, with more than half of those drugs given in excessive dose.
The use of antipsychotic drugs when they're not necessary is a form of restraint. It's a form of chemical restraint.
The Department of Health and Human Services also says it's very concerned that there are financial incentives for unnecessary drug use. In the past, those incentives have led to charges of kickbacks between nursing homes, pharmacies, and a drug company. Dr. Kenneth Brubaker represents nursing home medical directors and agrees antipsychotics are being used too often. He says the problem is staff turnover and training.
Oftentimes, lack of training, lack of adequate workforce, whatever else it might be, we tend to shortcut it by going to drugs.
I wish I would have said, what are you giving him? How much are you giving him?
Instead, Burchard sued and settled, using some of the money to create a nursing scholarship in memory of her dad. Armen Keteyian, CBS News, New York.